Ladies and gentlemen, boys and girls, greetings from me, that is Ashok Kumar Batham, MD Pharmacology, PhD Pharmacology, and of course, a degree in medicine obtained way back in 1973. With more than 45 years of my experience, I feel confident to talk to you about various drugs, therapeutics, and issues in medicine, including the current and recent developments under Dr. Batham's narratives. Under Dr. Batham's narratives, this is a first video which talks to you about an interesting development that has happened last year in the month of March in the form of a fast-track breakthrough therapy designation of SPRAVATO, a brand of S-Ketamine nasal spray. S-Ketamine nasal spray represents a revolutionary therapy that has addressed a major problem with which psychiatrists have been confronted for the last 70 years or so, ever since they started using antidepressants, whether they are MAO inhibitors or monoamine oxidase inhibitors, or they are drugs that block the reuptake of norepinephrine or serotonin and or dopamine. Those things are known to them. The major shortcoming of those drugs has been a long lag period of 3 weeks, and at times months, which is required by these drugs to exhibit prominently their antidepressant effects. Thereby, they show an removal of depression. S-Ketamine is a drug which does not wait for so long. It produces its effect within 2 hours, and the effects reach their peak in 72 hours, and virtually the benefits last for about a week, and therefore it is recommended to be given once in a week as a nasal spray of 28 milligram. Further dose escalations can be made to 56 milligram or 84 milligram depending upon the need, but the administration has to be done under the supervision or by the healthcare worker, and then the patient is sent home with certain cautions and precautions and warnings, because this drug can lead to sedation, mental disassociation where there is lack of orientation about time, person, place. The person may not identify himself for some time, and there may be an hallucination or out-of-body experience, and the drug has a high potential for abuse and misuse. In fact, ketamine has been used as a street drug for quite some time. Ketamine basically is an anesthetic agent which is called neuroleptic or dissociative analgesic, and it was introduced way back in 1960s, where it was used in soldiers in Vietnam War. US FDA approved the drug in 1970 for use in anesthesia, and it was also used in veterinary medicine for administration to horses for performing surgical procedures, etc. Since 1970s, ketamine is widely used all over the world in operating rooms by the anesthetists. People started taking interest in the antidepressant effects of this drug since 2000, and a large number of clinical trials have been conducted. A randomized controlled trial in the American Journal of Psychiatry found that ketamine demonstrated rapid antidepressant effects, which was published in 2013. A review of 7 randomized controlled clinical trials in mental health clinicians revealed that ketamine provided a statistically significant improvement over placebo in treating major depressive disorder, and this review was published in 2017. In 2019, a publication called a double-blind placebo-controlled study in major depression in the British Journal of Psychiatry again demonstrated rapid improvement in the symptoms of treatment-resistant depression. Based upon these and 4 other major studies that US FDA took into consideration for approving this drug as a breakthrough therapy under fast track in March 2019, the drug came into existence for prescription by the psychiatrist under a REMS program, which is risk evaluation and mitigation strategy, because the drug has a very high risk of causing sedation, psychomotor impairment, inability to drive a machinery or operate an aircraft or drive a vehicle. And because of these reasons and the dissociative state of mind, including hallucinations and the potential for abuse and misuse, the drug has been allowed to be marketed under a risk evaluation and mitigation strategy, what we call REMS or REMS. So this is a useful drug, and useful in the sense that patients who fail to respond to conventional antidepressants, they have been shown to respond well to this agent, and therefore the specific indication of S-Ketamine nasal spray is treatment-resistant depression or TRD, in which the patient has failed to respond to 2 different classes of antidepressants and that are administered for sufficient time in adequate doses. So it appears that this drug has changed the entire strategy to treat depression, and the outlook of therapy appears much brighter compared to the conventional agent, particularly in terms of onset of action, which is immediate. And not only it's the immediate onset action, but it is a long-lasting effect which separates us miles apart from the conventional antidepressants. With this, we hope that this drug will bring in a paradigm shift in the way we treat mental depression. And that is what I wanted to share with you today. Thank you very much indeed for watching, and please give me a like if you like this information and the way it has been presented. You may also subscribe to my channel, Dr. Bathams Narratives, for further information, more videos on medical subjects, particularly relating to drugs and therapeutics and of course medical aspects. Thank you very much once again. Welcome.